That's it, thanks.
Stage 3 audio.
Extra credit, right?
First one, I'm sorry?
Extra credit.
Extra credit? Of course. Of course, it's let's do the attendance for both of you guys just late. Let's start. It's 9:30 now. Today we're going to study EKG. EKG. The word EKG means what?
Cardiogram.
Electrocardiogram, right? So when you do EKG, what you're recording? The electrical activity of the heart. We don't record the contraction of the heart. We don't record the size of the heart. We don't record the valves of the heart. We record the electric activity of the heart. Is that clear? Very good. When you go to the medical office, if you have a health problem or just for checkup, and the doctor tells you what? Go do EKG. Why? What are the indications of EKG? Indications. Chest pain, number one. Number one, history. Chest pain, automatic. When you ask the doctor, when you tell the doctor the main chief complaint is chest pain, automatic. X-ray, EKG, automatic.
Age.
Step by step. What did you say the next one? The next one is what? History.
Yeah.
Family history. If the patient having family history of heart attack, so he gotta do a EKG. Okay. What else? The age. What's wrong with the age? Sometimes you go into the doctor for checkup and you don't have family history, you don't have a heart problem, and you have nothing. It's just going there for checkup and says, okay, do EKG. What do you think the reason is? Age, above 40. If you're above 40, automatic, he will do EKG for you. Is that clear? So how many indications so far?
3.
3, which are chest pain, family history of heart disease, doesn't have to be heart attack, heart disease, and age above 40, indications. Okay. Also to diagnose any arrhythmia. If you have arrhythmia, arrhythmia means what? Irregular heartbeat. If you have arrhythmia, they do EKG to assess the arrhythmia. That clear? Also, if you have cardiac infarction, myocardial infarction, they do EKG to see how much damage happened to the heart and the site of infarction. The EKG determines the site of infarction, if it is anterior or posterior. Sometimes they call it medial and lateral, but anterior and posterior. And also the site of infarction and the extension of the, if it's extensive. Okay? What else? Sometimes you have electrolyte imbalance. Electrolyte imbalance, it affects the heart. And the heart heart will be arrhythmic, irregular heartbeat due to electrolyte imbalance. Is that clear? If you have vomiting and diarrhea, gastroenteritis, and you're losing a lot of fluid, and you start to feel the heart problem. Why is the heart problem? Because electrolyte imbalance affect the heartbeat. Is that clear?
Like low blood pressure?
No, electrolyte imbalance. No. If you have history of high blood pressure, usually having history with heart disease, they are combined together. They are like brother and sisters. High blood pressure and heart attack and arrhythmia, because heart, it will produce overload on the heart, so the heart will suffer with the high blood pressure. Or the last indication is to assess the treatment of heart diseases. Sometimes we take treatment for the heart. They do EKG to assess the treatment, if the treatment is enough, or they have to change it, or to increase or to decrease the dose. All these indications, you have it here in the first page of handout. How many? 8 indications. That clear? Very good. What is the role of medical assistant? In the EKG, the procedure, during the procedure, EKG procedure, what is your role? Your role is to prepare the patient to do the EKG, and if it is old machine, you have to mount it. Mount it means to cut every lead and attach it to in a piece of paper, and you write here, this is lead 1, lead 2, lead 3, and so on. Okay, this is mount. Also, your responsibility is to keep the privacy of the patient. Privacy of the patient is very important. When you have time, this is a machine, this is an EKG machine. When you have time, like you see that there is a cable here, we have 10 cables here. If you don't organize, you will take a long time with every patient to just separate it, and you start to do the EKG. The EKG itself, it takes like 5 minutes to do it. But if you spend time just to separate this cable, you will take more time. So when you have time in the medical office, just separate it and make the machine ready to use. Ready to use. So when the patient comes, you don't spend that much time. This is when you do the EKG, it's not enough to do it professionally with excellent experience. This is not enough, but you have to do it professionally with a good smile, and the patient has to feel secure when he's doing the EKG. EKG is non-invasive procedure, and it takes short time. It's not painful. Okay, very good. Last time we studied the circulatory system. Circulatory system, you was in here. Circulatory system. Did you study the heart circulation in the anatomy and physiology? So you have an idea about circulatory system. Very good. The circulatory system this diagram this diagram, it shows the systemic circulation, and also this is the pulmonary circulation. This is the pulmonary circulation. This is the lung here. And then the aorta. Can you remind me how many circulations do we have in our body? Many circulations. Okay, thank you. This is the main one. What we call the main circulation. Systemic circulation. The circulation all over the body, we call it systemic circulation. Is that clear? This is systemic circulation. When the blood goes to the lung and come back to the heart, what we call this? Pulmonary circulation. This is pulmonary circulation. We have another circulation inside the liver. What we call it? Portal circulation or hepatic circulation. Portal circulation, fine. And also we have the kidney circulation, the kidney. Renal circulation. Renal circulation. So every system having its own circulation with different rule. The blood pressure in the lung is not 120/80 like the systemic blood pressure, and the kidney is completely different. Every organ having its own rule on the circulation. Is that clear? That's why we have different circulations in your body. So when the blood goes to the lung and come back to the heart, this is called pulmonary circulation. Is that clear? Very good. The heart is formed of how many rooms? 4 rooms. What are the names? Right atrium, left atrium, right ventricle, left ventricle. Now, when you see the color here, it's different color. This is blue color. This is red color.
This is deoxygenated and this is oxygenated.
Which one is deoxygenated?
Blue.
The blue one. So the blood, the right side of the heart, when we talk about the heart, we don't talk about the top and the bottom. We talk about the right side and left side. So the right side of the heart is dealing with what? Deoxygenated blood. Deoxygenated means less oxygen, right? The left side of the heart dealing with what? With oxygenated blood. Where the deoxygenated blood coming from? Coming from the two big veins. Two biggest vein in the body. Superior vena cava and inferior vena cava. Going to so the blood coming this way. Deoxygenated is coming here, from here. So the inferior vena cava bringing blood from level below the heart, and the superior vena cava bring blood from the level above the heart. All this blood from below and above collect to the heart, deoxygenated blood, through superior and inferior vena cava to the right atrium, and through this cusp, tricuspid valve to the right ventricle, and then through it is all bicuspid, but this is only tricuspid, but they have names. Pulmonary valve, we call it semilunar pulmonary valve. Listen, the two in the middle here, semilunar. This is semilunar pulmonary valve to the lung. What happened in the lung? Oxygenated. Oxygenated. It leaves the carbon dioxide and it takes the oxygen.
Good evening.
Good night. Good night. Okay, and then when it becomes oxygenated, rich in oxygen, it goes back to the left side of the heart, left atrium, through 4 pulmonary veins. Okay? Through four pulmonary veins to the left atrium and through mitral valve to the left ventricle and through semilunar aortic valve to the aorta to all over the body. Here the aorta, it divides. Aorta is the biggest artery in the body, then it divides into arteries and arterioles, and finally the smallest branch is what? Capillaries. And still, the blood is still oxygenated here, right? Now it returned back to the heart deoxygenated. What happened here? What happened here? Where the oxygen goes? Oxygen goes to the tissues, right? It gives the tissues oxygen and nutrients for the metabolism of the tissues. And then it takes what? Carbon dioxide and waste product. The carbon dioxide is eliminated through the lung and the waste product eliminated through the kidney. And that is circulation. Okay, and then it goes back to the heart deoxygenated and oxygenated, distributed, and all over, and so on. And that's why we call it circulation. Any question? Clear? Very good. What is the heart rate, regular heart rate? 60 to 100 beats per minute. So the heart rate, not human resources, okay, heart rate. 60 to 100 beats per minute. How about if you, that's when you're sitting, right? Or sleeping. In a rest state, right? Resting condition. How about if you run? What happened to the heart? Increase tachycardia, right? It goes above 100, right? And when you rest again, it goes back what? To normal. Is that clear? Now, is the heart control itself, or we have certain center to control the heart?
We have certain sensor.
SNO.
Synaptial. It controls both of the
It's
Double.
Okay. Where is the center that regulates the heartbeat?
above
Huh?
on the left side.
on the right, on the right side.
This is another diagram for the heart, simple diagram, because we need to,
On the right side.
on the right side, just next to the superior vena cava here, we have, this is the boss of the heart. This is the boss of the heart. And this is called sinoatrial node.
Yeah.
And you know that doctors are lazy. They don't want to say sinoatrial node.
Yeah.
SA node. So they said SA node. This is the boss of the heart. Is the heart active or lazy?
Later.
Lazy.
Lazy. Why lazy?
It push harder.
Huh? Because it doesn't work. It's just when the boss give a message to work, it works. When the boss sleep, the heart sleep. That clear? So the heart follows the signals coming from the superior center, which is the SA node. Very good. The SA node send a message to the heart to beat, to contract. This message propagate first through the both atria. You have to know the difference between atria and atrium, right? What is the difference?
The plural.
Which one is plural?
Atria.
Atria is the plural form of atrium, right? Very good. And then we have another node here.
Bundle.
It's called what?
Bundle.
Atrioventricular node, but doctors are lazy. They don't want to say atrioventricular, it's too long. AV node. AV node. Why do we have AV node here? Because look at this here.
Pacemaker.
No, this is a pacemaker. The SA node, we call it pacemaker. Pacemaker to initiate the work. SA node. Okay? How many septa here? We have septum here, it separates both atrium, both atria, right? What we call this septum? Atrial septum. It separates both atria, right? Because the blood doesn't mix together. The deoxygenated and oxygenated doesn't mix together. So we have a septum here to separate the both atria, and it's called atrial septum. This septum separates the two ventricles. What we call it? This is atrial. This is ventricular septum or interventricular septum. And this septum separates the atria from the ventricles. What we call this septum? Atrioventricular septum. Again, atrial septum, ventricular septum, atrioventricular septum. Okay. Well, actually, the AV node here is very important because the message propagated through the atria here, coming from the SA node, is not able to cross this septum, the atrioventricular septum, to go to the ventricle. So we have AV node located here. It facilitates these impulses to get through. So this is a pathway of electricity. And then following the AV node, we have bundle of His, and the bundle of His having the right branch and left bundle branch, and then Purkinje fibers here. Purkinje fibers. Purkinje fibers. How many systems in the heart?
Two systems.
The heart containing how many systems?
Two systems.
Two systems, which are
Contractive system
contractile system
and conductive.
and conductive system. We have contractile system and conductive system. What is the contractile system?
Myocardium.
The myocardium. The muscles of the heart. What is the function of the muscles? Any muscle. Contraction and relaxation, right? That's why the muscle of the heart, the myocardium, we call it contractile system. That is the function, pumping action. Is that clear? For the contraction of the muscle and relaxation, in the regular muscle, regular skeletal muscle, we call it contraction and relaxation. In the heart, we have a different name. Contraction of the myocardium, what we call it? Systole. Systole. And relaxation, we call it what? Diastole. So we have systole and diastole. What the systole means? Contraction of myocardium. What diastole means? Relaxation of myocardium. Is that clear? That is a contractile system. What is the conductive system of the heart? Huh? What is the conductive system? This is a conductive system. SA node, AV node, bundle of hairs, right and left bundle branch, and Purkinje fibers. These are, we call it the conductive system of the heart. Any question? Now we need to study how the electricity travels from place to place. We studied that last right? Like we mentioned before, the muscles and nerves, they working with the same mechanism, electricity, with the electricity. And the electricity, this is a mechanism of or movement of the electricity. This is a muscle fiber of the heart, for example. Anything inside here, we call it what? Inside the cell. We call it what? Intracellular. Anything outside here, what we call it? Extracellular. We have some intracellular components and we have extracellular components. They are in balance all the time. Intracellular and the extracellular. Is the body having potassium?
Yes.
You sure you have potassium in your body?
Yes.
Thank you. And you have sodium too also?
Yes.
Very good. The cell here, it likes potassium and doesn't like sodium. That's the nature of the cells. So the cells like what?
Potassium.
Potassium. And it hates what? Sodium.
Sodium.
So it keeps the potassium inside and it keeps the sodium out. Is the cell happy now?
Yes.
What happens when you're happy?
Smile.
Relaxing. Relaxing, right? When the cell take the potassium, that's what it likes, and the sodium out, and now the muscle of the heart is relaxing, happy, relaxing. What we call this?
Polarization.
Polarization,
Polarization.
and the muscle now is polarized. Polarized. What's polarization means?
Relaxation.
Relaxation. Polarization means relaxation. There is no signal now. Muscle is sleeping. Now, when the signal comes here, SA node start to send the message. This message runs this way. The sodium goes in and potassium go out. With other stuff, I don't want to give you more trouble.
The cell is active.
Just, it's enough to understand, to remember sodium and potassium. Because calcium and chloride, they follow sodium. Wherever the sodium goes, chloride and calcium follows. But you don't have to have a pain in the neck. So when the sodium goes in and potassium goes out, now the electricity is here. Now next, now the stimulus is here, and so on. It runs this way, sodium in and potassium out. Is that clear? When the sodium all over the place here, it's intracellular and potassium outside. Is the cell happy now?
No.
No. What happened with the cell? With the muscle fibers? Contract. Contraction. And what we call this?
Depolarization.
Depolarization. What's depolarization means?
Contraction.
Contraction. Can we say depolarization means sodium in and potassium out? Yes.
Yes.
And then the muscle is contract, is not going to be contracted all the time. It has to relax again, right? So it has to reverse. Everyone take its original place, potassium in and sodium out, and then what we call this?
Repolarization.
Repolarization. Repolarization. So repolarization means re-relaxation. Relaxation again. Is that clear? Until here is clear. Very good. Anything hard? What's your name? Amina.
No, it's clear.
Everything is clear? I showed you the EKG paper. For the EKG machine here, the EKG machine, we have different styles of EKG machines. This is the advanced one with it's computerized with the screen. You can watch, see the waves before you print it. But this is the idea of the EKG machine. Tell me, you do EKG, right? You put the electrode in the heart? Do you have to to open the heart and put the electrode inside? No, you put it in the skin, right?
Yes.
And the skin. Is the electricity of the heart goes to the skin? Yes. How it goes to the skin? This is the man. The electricity of the heart, it starts from the heart here, and it goes through the upper arm this way, and then this way, and then this way, this way. So when you pick up the electricity from here and here, this is electricity of the heart, right? Also, you can pick it up from here and here. Very good. Actually, you can pick it up in any way, anywhere. during the pathway of the electricity. If you have someone having amputation arm or amputation leg, how to put the electrode here? You can put it here. Is that clear? Because the electricity goes here before it goes here, right? Same thing, you can put the electrode here. Also here, if you have amputation arm or inflamed arm, you can put it here. Is that clear? If you know the direction of the electricity, you can catch the electricity in its way, during its way to go. You can pick it up from here or from everywhere. So whatever the office, the procedure of the office, sometimes when you teach the classical way how to do the EKG, sometimes you go to a certain office and they do it a different way. Just follow their way because it's the same principle. Is that clear? Same principle. You put the electrode here and say, no, we put it here. No problem, you just put it here. No problem. Is that clear? Very good. This electricity, when it comes from the heart and it runs all this way, it becomes weak here. Weak. That's why we need to potentiate it, to magnify it, right? The EKG having amplifier here, amplifier, to magnify the electricity, to make it bigger. And then it sends it to the galvanometer here. Galvanometer